It's really a full-time job being a cancer patient, and there's a lot to do. I was introduced to what they call a multidisciplinary team, and my main contact there was my oncologist. But the multidisciplinary team meets regularly to discuss my case, and that involves not only the oncologist, but also the surgeon involved and the radiologist. Sometimes, if you're sitting with your oncologist and sitting with your surgeon, they're delivering bad news and there's a moment that you just freeze. So I really recommend that if you go and see your specialists, that you bring some good friends or family with you. It's important before you go and see your surgeon, before you go and see your oncologist, write down all the questions, whether it be about health insurance, whether it be about alternative treatments as well, and also about complementary treatments such as acupuncture or seeing a dietitian or seeing a physiotherapist, and what would be helpful. As part of that medical team, you not only have your oncologist and your surgeon, your radiologist, but also have a dietitian as well. So speaking to a dietitian was very important to know what to eat and what not to eat. And also having a physiotherapist so you know how to adapt to your new body, especially after surgery. Having a cancer coordinator as well, being the liaison person, to be able to answer questions, but also to engage with the services that are available for cancer patients, including the Cancer Council. They've got a wealth of resources there, whether it be the Cancer Connect program, where you can talk to somebody perhaps that has been through that journey before you, and shining a light on that sort of dark and murky journey that you're about to go through, and somebody who has that lived experience to be able to tell you. And the other organisation, including places like Pancare, for example, that focus on upper gastrointestinal cancer. There are nurses that you can call, there are support groups that you can engage in, there are dietitians that you can speak to. Sometimes there's not enough time speaking to a medical specialist like your surgeon or oncologist, and sometimes you just need a little bit more space and a little bit more time to ask the questions. And the other person I really felt I had more time to speak to was my psychologist, or what they call a psycho-oncologist. And that's a psychologist that specialises with cancer patients. And the beauty of that is that you don't have to explain to a psychologist what you're going through, because they understand what you're going through. They understand the grief, they understand the stress, and they also understand the journey that you're going through and the technical terms, perhaps more than you do. And so they were able to fill in the gaps that you might have and that you might not necessarily get from just the surgeon or the oncologist. My psycho-oncologist was an important part of my recovery, and she still is an important part of my recovery now. I still talk to her with less regularity, which I'm pleased to say, but she still is part of my journey because it's an ongoing journey.